Hey guys, welcome back to the Bearded Chokra. मेरा नाम है अभिजीत बंसाली and this is the first episode that we are going to shoot of #ExpertSePucho, and the expert I have today with me is Dr. Umang Kothari. First of all, welcome sir.
Thank you very much.
Yeah. And so ये जो series है, I'm going to tackle a lot of questions, hair related, gynecomastia related, skin whitening, skin lightening related. There's going to be a lot on this particular series. We are going to start with PRP, which is a very, very common treatment for hair thinning, hair loss. So first things first, I think just introduce yourself to the Bearded Chokra family.
Hi guys, so I'm Dr. Umang Kothari. I am plastic surgeon and I have a clinic in Malad, Mumbai, and it's named the Hair and Shape Clinic. In the Hair and Shape Clinic, we are giving few services like hair transplant, plastic surgery, cosmetology and laser services, and obesity clinic.
Okay, so the topic जो आज हम cover करने वाले हैं is going to be PRP, which is platelet rich plasma therapy. First and foremost, what is PRP?
As you rightly said, Bearded Chokra, it is a platelet rich plasma. Platelet is one of the blood components in your blood. So जो आपके blood में cells होते हैं जैसे RBC red blood cells, WBC white blood cells, and platelets. They have a concentrated growth factors which are good for your well-being, okay, or any tissue well-being. So it is तो हम उसको harvest करते हैं and आपके scalp में, face में, जहाँ भी requirement है वहाँ पर उसको inject.
So basically it has a recovery potential.
I could say that it's a healing potential.
Right.
Yeah.
Correct.
Yeah.
Okay.
Yeah.
Okay. So apart from what is PRP, what does it actually do?
Yeah, it's a very good question because lots of confusion, lots of misinformation, I would say, is there on a social media, is there on the platform, digital platform. So I would say कि I'll simplify it. Basically what happens that we withdraw the blood from the patient, we process it, we centrifuge it. Now it's a normal physics that when you centrifuge a chemical, a kind of or mixture, those we have the high density which will settle at the bottom.
Right.
With the low density, it will float as a upper solution.
Correct.
Same thing happens with the blood. The cells, they settle down, the plasma or a kind of white blood, it separates out.
Correct.
At the junction of these cells and the plasma, the thin buffy coat layer which heads the platelets.
Okay.
Because they are less in the weightage than the RBC. So red blood cell that settles down, plasma being a liquid, it stays in above. At the junction of these two, there's a ream of platelet.
Okay.
We take that out and then we inject it. We add some activators to it so they get activated.
Okay.
And this PRP, it is used in the knee for the arthritic patient with a sports injury. It is used in the face for face glowing, and it is used in the hair or a scalp for the hair regeneration.
Okay.
It has multiple use. It is used even for the stomach ulcers, even for the infertility in uterus.
Oh wow.
Yeah.
Okay, so it has a wide range of benefits all throughout your body.
I say it's a jadi booty.
Right.
It's my jadi booty.
Correct. So we know PRP, at least what it's there on the internet, it's all about hair.
That's right. But there are multiple
right.
use.
So can it be used for beard growth?
I doubt that. I have no personal experience in that, but definitely it can be tried.
Okay.
And I have to see the literature for that. I'll definitely do that and come back to you on that.
Right. Okay. Okay. So PRP क्या होता है वो तो हमने जान लिया. Now how is it different from mesotherapy and hijama? अभी hijama बहुत ज़्यादा popular हो गया है. Very recently it has become extremely popular.
That's right.
on the internet. And what is the difference?
You have to understand that any regeneration will require a blood vessels to grow.
Correct.
Then only there can be a regeneration.
Correct.
So anything which I want to promote as a healing or I want to promote as a hair to grow, I have to provide the nutrition part, and for which I require a blood vessel.
Correct.
With this fundamental, there are different modalities by which it can be improved. Hijama is a kind of a external suction pressure, and when it has been applied, it sucks out or it stimulates the new blood vessels formation.
Got it.
In plastic surgery, this principle is known as a tissue expansion. This has been used in plastic surgery, and these people are doing really well with the same fundamental, and people are having the results. That's why they are doing it.
Correct.
PRP is again when we are injecting, it stimulates the new blood vessels to grow.
Right.
So if not by the pressure, they are stimulating the cells to grow.
Correct.
Eventually, it's a new blood vessel.
Right.
Mesotherapy at the same time, again, it stimulates the hair follicle to grow.
Correct.
Everything is on the stimulus.
Right.
And you can say the problem or the misconception is there because the exit signaling is not known. If you know the exit signaling, it is very much simple.
Right. Correct.
So that's why the fundamental is to improve the blood vessels, improve the nutrition. That can be mesotherapy, that can be PRP, or that can be hijama.
Okay, so as far as what I'm understanding, hijama is when you're making those micro cuts and then you're putting a suction and taking the blood out. In turn, वो आपका blood circulation बढ़ा रहा है. As far as PRP, mesotherapy is concerned, you're injecting something back into your scalp making that blood circulation happen.
That's right. Similarly, suppose if I have a wound on my hand, even if I do nothing, it heals in 7 days. How?
Correct.
There's an inflammation process. There's a pain for 24 hours to 48 hours.
Entire cascade.
Then cascade starts now. So in PRP stimulates the cascades.
Okay.
Because in a normal wound healing, the similar thing happens over here with the growth factors. Same thing we do it in a controlled manner or in a intentional manner in the scalp.
Okay. One more question. Why plasma and not any other component of blood, or why only platelets? As you said, there are some growth factors, but is there anything extra special about that? Or why are we not injecting some other compound totally into the scalp?
Because they doesn't have anything. You have to understand that anything we are going to inject as a medical therapy, it has to have a potential.
Correct.
So likewise saliva, semen, it doesn't carry any important cell which are going to be useful. So then why to inject?
Got it.
When we know that blood has the plasma, the blood, RBC, WBC, the platelets are being studied in detail about it. They have the granules contain 17 to 18 growth factors and they can be retrieved from that, and that's why it's been used. It is not like over the night it has started being used. It's been researched upon then it's been used. There are radiological evidence that if we inject it even in a joint, there are cartilage regeneration, the new cartilage is formed.
Got it.
So when your body itself has a potential to heal, then might as well use your body cells. Why to use the external thing?
Correct. So in mesotherapy, you are injecting something like minoxidil or some peptides or something
like that. So in PRP you don't.
Okay.
In
So
PRP it's autologous.
Okay. One question. अभी आप लोगों ने बहुत सारे सवाल पूछे. I'm not going to waste time, taking that person's name जिसने सवाल पूछे. I'm just going to put that in this entire questionnaire that I have. One question: is PRP FDA approved?
The PRP is FDA approved, yes, because it is the person's own body fluid which has been going again in the same person within half an hour to 1 hour.
Got it.
That's why it's FDA approved.
Right.
In which I'm not going to store your blood. I'm not going to use that blood anywhere else. So we are just withdrawing, processing and putting back into the same person. I'm not going to use your blood for another person.
Right.
So it is FDA approved.
One more question. Is there any scientific backing to show that PRP causes hair growth?
Definitely there is. There are so many pictures we have. There are so many clinical photographic evidence we have. There are so many research papers are present even in online that if I take a biopsy of a scalp, I see there are various hair follicle at a different level. Some in telogen, some in ketogen, some in anagen. Then we study that as a square centimeter density. That in this much square centimeter density, if this much amount of percentage are in telogen or ketogen, after giving PRP, what is the situation?
Correct.
What is the thickness of the hair follicle? It's all been researched upon. Yes. The problem being that is how you make PRP. There's lots of articles and their own methods. Again, the research about making the PRP, the centrifuge force in which the centrifugation occurs, the G, the gravity factor, how it affects, the activator, the temperature, the needle by which you inject, everything is being studied upon. And different people have their different methods. The amount of blood you withdraw, the amount, the how you take out the PRP, everything is important.
Okay. That's very nice. And jitne bhi research papers mujhe milte hai regarding PRP, I'm going to link them in the description down below, so you can check that out. Apart from that, now let's talk about if someone wants to get a PRP done. What are the criteria? How do you judge if that person is the correct candidate for PRP?
So there's a clinical call. When I see the scalp or some patient's scalp, if I see the density is reduced, but I see there are small hair follicles which are still has the potential to grow, then we'll stimulate them to grow. That is one.
Okay.
Secondly, understand PRP is a fertilizer. PRP जहाँ पे हेयर फॉलिकल है उस पे काम कर सकता है. जहाँ पे हेयर फॉलिकल नहीं है, the smooth shining skin without any ostium of hair follicle वहाँ पे काम नहीं करेगा. Because the hair follicle is not there.
Correct.
It can stimulate a hair follicle in a different phase. But if the hair follicle is dead, then it cannot do anything.
Okay.
So if the patient comes to me with a temporal recession, कि इसमें PRP डाल के hair grow कर दो, it's a no.
Okay.
But if the patient comes to me कि no, I'm having some density, less density here, do something about it, then yes.
Okay.
Then yes. Okay. So that is a criteria that he should have a live hair follicles there.
There should be some scope of growth.
Some scope of growth.
Right.
So for areas where there is no any blood, any follicles, you plant the follicles. You do hair transplant and then work upon it with PRP.
Okay. So talking about the criteria's age, what is the minimum age? Because मेरे को ऐसे comments आए हैं where people are like, I'm 16, I'm 17. Can I get a PRP done?
Bearded Chokra, you have to understand one thing, that the baldness has coming in a very early age now, and with the stress factor, with the digitalization, with the urbanization, the eating habits, it is very early.
Right.
I am starting PRP in 16 years old, 15 years old, because they are losing the confidence. They are still in the schooling, maybe in the primary or in college, and they are losing the hair, and then they are losing the confidence. I have few engineering friends. They are like, I'm going for my vivas with a cap on, because the moment I take off my cap, I lose my confidence.
Right.
And they are getting the KTs, and these are like real problems.
Right.
So PRP, if done well, it is very much, it can be done in an early age, because there's a growth potential.
Correct.
Everyone knows the young body has a growth potential.
Exactly. Correct.
Yeah.
So anyone, so is there like a base age where you, below which you don't do it?
No, I don't think so. But normally, as for any reconstruction or any aesthetic, we say puberty is a good age, because in puberty, maximum hormonal changes occurs. Puberty. Of course, I'm not going to do anything for the 6 years old or 7 years old.
Obviously.
We wait for puberty to occur.
Right.
Maybe 17, 18 years, 16 years, because by that time you analyze how you are growing.
Exactly. Okay.
Yeah. And so elderly, we have done PRP even in 73 years old post transplant. Okay. So the spectrum varies from 17 years to 73.
Okay.
At least in this clinic.
Right. So you've got a good age range.
Even in females are very good responders for the for PRP.
Okay.
Yes. Yeah.
Okay. Apart from this, now next thing, what is the stage of hair loss? As you said, you must have some potential of growth. There can't be a clean scalp where light is reflecting and then you can't see anything. There's no scope of growth. So is that's the only thing that you look at, or is there something else like you go and do some microscopic search or something like that?
For starting the PRP treatment, advisably that there are dermatoscope, there are videoscope in which you see the density.
Right.
But the clinical judgment is as good as all these supplementary things.
Correct.
Of course, to document it is very much important.
Right.
Because clinical judgment is very much personal to me. I cannot, even if I see the patient is supposed he is unhappy, even if I see the result, I cannot make him convinced that you show the result.
Exactly.
So for all those purposes and prognosis, it is important to have all the scopies and the studies with you.
Right.
Otherwise, it's a clinical judgment.
Right. Okay. We covered age, we covered stage of hair loss. Gender, you said male, female, anyone can do it. There is no problem with gender at all. Medical conditions.
Yes. So if the hormonal therapies or there is a hormonal changes are there in the body, I would say the primary pathology of hair loss, like starting from this, we have to have the diagnosis in my hand.
Okay.
I'm here as a surgeon to treat you. You come to me with a baldness, but to ask the history, how it started, what is the pattern of hair loss, what is your lifestyle, what you do for living, everything is important to me.
Correct.
Because that gives me a kind of a baseline idea that how you are going to progress or how you are going to proceed in your disease.
Right.
So the primary pathology is very much important.
Okay.
Whether it's a hormone related, whether it's a stress related, is a androgen related, or is a hereditary, genetic, nutritional.
Okay.
That is the first most important part in the first consultation.
Okay.
And then definitely you control this, you give PRP, you get results. PRP is fertilizer. Suppose there's a continuous trauma because of any of the insulting factors on the hair follicles, and I'm just giving PRP, it is not going to do effect. But if I control the insulting factors and then give PRP, I'll have better results.
Correct. Obviously.
So the fundamental change over the period of time, initially it was like you search for the cause and treat the cause.
Right.
Now, let the cause be if you can't diagnose the cause, but you strengthen the hair follicle.
Got it.
Because suppose you are having some problem, but there are certain hair follicles that are not falling. It is still there.
Right.
Why? Because they are strong.
Correct.
So rather than finding the cause, you prepare all the hair follicles to be strong.
Got it.
And you give PRP, you give nutrition, you give supplements, you give cyclical therapy to strengthen the area rather than wasting time in finding the cause, and of course give the empirical treatment so that most of the causes are being tackled.
Right. So is there like diabetics cannot get PRP
No,
done?
they can. They can.
Okay. So any medical condition where you avoid giving PRP?
There are few. One is there is a less platelets. There's a malignancy.
Okay.
And definitely we have to customize it, and that it's not the these are the things which should be in the consultation, not on the YouTube, because it will create unnecessarily confusion.
Right. Okay.
But definitely there are some condition where the doctor, any treating doctor, will advise you not to go for PRP.
Right. Okay. So if anyone has a pertaining or a persistent medical condition for many years, तो best होगा कि आप यहाँ पे आओ clinic पे. It's in Malad. Come here, get consultation with Dr. Umang or his entire team over here. They will, and I must say this, you have one of the most friendliest clinics that I've been to.
Thank you.
Usually क्या होता है, clinics बहुत depressing होते हैं. Like, I personally hate going to clinics and meeting doctors. I just hate it. But when I came here, I met you for the first time. I'm like, ये घर है. So literally, you come here and you feel like you're in a very well-made, very happy place. If we talk about how many sessions on an average does a person need to get?
Again, very much variable, because it is something which we don't know how it's going to act. But in my center, we give 4 sessions every monthly. Okay. And then we take a halt. We see for 2 months how you are responding, because the PRP has a success rate of 70 to 80%. Okay. That means if I'm doing PRP in 10 patients, 2 or 3 may not get the result.
Right.
And 70 to 80% they get the results. Now results are in a 4 things. One is a decrease in hair loss, increase in the density, then increase in the thickness of existing hair.
Correct.
And more lustrous hair.
Right.
Now there are few patients which are getting the result by the first PRP. There are few which are not getting the result after 4th PRP. There are few patients who got the 2 result out of 4. There are few patients who are not getting anything. So it's very much variable.
Got it.
I cannot ask you to take 10 PRPs when you're not going to get the results out of it.
Exactly.
So it's a waste of manpower, it's a waste of money, it's a waste of traveling time for a patient.
Correct.
So take 4 PRP, wait and watch, you are responding to it or not responding to it. If you're not responding to it, we change our methods for you.
Right.
We improve something for you.
Right.
So 4 PRP
on an average. So 4
every
months.
monthly, because when we inject the PRP, the cycle starts to repair the problem, which lasts for 21 days.
Okay.
So from 3 weeks to 5 weeks, people come back to me. In a month, we are doing 85 to 90 PRPs. Saturdays are really full of PRPs, and people are traveling across the cities for PRP.
Right.
And it is really helpful. That's why people are doing it. Otherwise,
Exactly.
people will not do it.
Exactly. Got it. Is it like a one-time thing? Like suppose I come to you, I get 4 PRP done and suppose I'm happy with this result.
Yeah.
Whatever I got.
Yeah.
I stop.
Yeah.
And then I go about कि मैं अपना normal daily routine सब चला रहा हूँ जो भी कर रहा हूँ.
Yes.
Is there a chance of reversal?
Again, having the hair fall?
Yeah.
Yes, there are.
Okay.
There are.
So whatever I gained from PRP, can I lose it?
Yes, you can.
Okay.
See, understand one thing, that any regeneration will require some maintenance.
Obviously.
When I'm talking about this, it requires lots of efforts to rebuild something.
Correct.
Likewise. So when we give the PRP, this is some new growth of the hair follicle which comes out, and there are good amount of patients, they don't require anything. What happens that because of any insult you land up in a baldness, it may not necessarily that insult is still there in your body.
Right.
And then when we do the regeneration thing or a medical thing, you are out of that baldness with a good hair. But a new insult can come at any point of time.
Correct.
And the problem with hair and skin, that they are being multifactorially affected.
Right.
That means they have been affected by multiple factors.
Right.
Environment, because it's a dynamic body. It is a static body. Your body is a dynamic. The amount of fluid you intake, the amount of protein you take, the stress factor, family stress, work-related stress, the disease which can occur to you, or addictions. Everything is affecting your hair. So it may happen that you are out of that baldness because of the PRP or medication, but there are certain things which are going on in your body.
Right.
If you are controlled in your diet, you know that what you are supposed to eat, drink, behave as a lifestyle thing, you may not get it back.
Okay. So suppose I do those 4 sessions, I'm happy with the result. Then what is like a sustained treatment?
It is
It's
customized.
Like, okay.
It is not like a blanket rule.
Got it.
Because I'm avoiding certain communication because that will create a kind of a crowd, a kind of a cloud, which I don't want to do that.
Got it.
But it is customizable. Suppose if you are taking the 4 PRP and you got the result, then I assess with your history, with your examination, what you are supposed to do. There can be just a medication, there can be just a reassuring consultation, there can be maybe more than that, maybe a hair transplant requirement. That has to be customized.
Right.
Or maybe nothing. Just there's a reassuring consultation.
So it's patient to patient dependent.
Patient to patient.
Okay.
But there are certain patients who are really happy with PRP. Again, indication of PRP, the phobia. If you are phobic to knife or if you are phobic for a hair transplant, you know it's a good thing, but you're scared. So even if how much ever I try to convince you, you would say, boss, I just don't want to do it. You continue PRP.
Right.
Or you are being exhausted by hair transplant. There are 1 hair transplant, 2 hair transplant, 3 hair transplant done, and you want to just sustain it.
Right.
Even that is the indication for PRP.
Got it.
Yeah.
Okay. So 1 session, how much time does it take?
15 to 20 minutes.
Okay, so that is after your blood is taken out
Withdrawn.
and your plasma is separated, all of that.
Yeah.
So with the entire process, like suppose I walk
30
into the clinic.
minutes.
Okay, so 30 minutes.
You can say walking, maybe the waiting time, then taking the blood out, processing it for 15-20 minutes, then preparing the PRP, giving you some ointment to be applied so that you get the minimum prick.
Right.
And some vibrators for the minimum prick, giving the anesthesia as per your comfort. Some patients are really dynamic. They take PRP even without anesthesia. Some people, they require lots of pampering, lots of holding the hands and applying. So it's customizable again. But on an average, 30 minutes.
Okay. So if I come in 30-45...
It's an office procedure. You can go back to your office.
Okay.
There is no shaving is required. No much of the pain is there. You sit here for maybe 10 minutes, see if you're not feeling any giddiness, you are comfortable, you have a cup of coffee, you can go to your work. Okay.
And what is like the level of pain? Like I know you've handled like thousands of patients now. So on an average, what is the level of pain? A lot of people have asked me this question.
If I see 0 as a no pain and 10 as maximum pain, like an excruciating pain, this would be somewhere between 2 to 3.
Okay, so it's negligible and
It's bearable.
Right.
It's like a dental treatment. The
Got it.
small one prick and that's it. And then it gives the anesthesia to the whole side.
Right.
And then it's easily doable thing.
Correct. So the level of pain is not much. It's very comfortable.
Very comfortable.
Okay.
I would say it's more of a discomfort than a pain. There are certain patients when I ask them, they're like, no, sir, I'm not having pain. It's a little bit discomfort, but it's bearable.
So you'll feel the prick, but it won't give you that.
You'll feel the touch, but you won't feel the pain.
Okay, got it. Okay, so now pre-PRP procedures and care. Suppose I am scheduled for a PRP today. What am I supposed to do at home and come?
You're not supposed to take any NSAIDs. This is a painkiller.
Okay.
That has to be stopped.
Okay.
You're not supposed to take any vitamins or Ayurvedic or homeopathic preparation which contents are not known.
Okay.
Because that can lead to certain things.
Correct.
That's the only thing. Otherwise, there's not as such a big thing.
Okay.
Yeah.
So, matlab, should I shampoo my hair and come?
Yes, you can shampoo without shampoo, everything. Because as it is, we're going to clean your hair when we are going to do your PRP.
Okay. So, no oiling, no product should be there in the scalp.
Even if it is there, don't worry about it.
Okay. So, it's
PRP
fine.
is inside. You do whatever painting you do outside.
Right.
Nothing is going to happen.
But it would be better if you have a clean slate.
Yeah, of course.
Yeah. Okay. Now, post PRP. Now, I've got my PRP done, and now what do I do? Like, I can go home and apply whatever I want?
There is one document which I'm going to give it to you. It is in detail post-procedure instructions. They've been displayed so they can have they have a detailed this thing. Don't worry about it.
Okay.
The funda is you are not supposed to take any NSAIDs, which is anti-inflammatory drugs, because you are in a way enhancing or stimulating an inflammation.
Got it.
So if you're having some discomfort, you can take a paracetamol, but not the NSAIDs, which are the prostaglandin inhibitors.
Right.
And when you are increasing prostaglandins by platelets, you don't want it to get inhibited.
Got it.
Yeah.
And any medication that you want to take after PRP, it's with your consultation only or with someone from.
We'll give the document so that it will be.
So the next question जो बहुत लोग को था was, can you undergo multiple treatments when you're doing PRP?
Of course you can. I mean, PRP is not the only solution.
Okay.
That's basically, it's a part of the whole treatment.
Okay.
And as I always say that we have to approach in a multiple way. Likewise, there are some tablets which are just to be taken, the PRP to be undergone, along with that some lifestyle modification, maybe hair transplant, maybe not, but it's always a part.
Okay.
There are certain patients, it can be the sole treatment, but most of the time it is combined with other treatments.
Okay, so I can be putting minoxidil, taking finasteride and doing PRP.
Of course,
everything.
because the hair fall is a multifactorial.
Correct.
So you have to even attack it as a multiple treatment modalities.
Correct.
Not only PRP.
Okay, perfect. Any particular diet during PRP?
Nothing. Not related.
Not related.
I would say related to hair fall, but not related to PRP.
Okay. What is the success rate of PRP?
70 to 80%. If I'm doing PRP in 10 patients, 7 and 8 are responder, 2 and 3 may not be the responder of PRP.
Okay.
But when you are not responder to PRP, we can manipulate it, we can do some modification to kind of give it to you.
Mm-hmm.
But unless you try, you don't get to know whether you are responder or not responder. So success rate, I would say 70 to 80%. Okay. I'm doing PRP over here from in a month we are doing 85 to 90 PRPs.
Wow.
So we have seen lots of patients which are just extremely happy with PRP, okayish happy with PRP, not happy with PRP.
Right.
But those who are not happy with PRP, we have to again sit and do the consultation that what went wrong.
Correct.
And to bring them out of the baldness.
Correct. So has there been a time where someone has started with a PRP, they are not happy with it, and then you shift them to meso or something like that?
Many of the times. Many of the times.
Okay.
Every treatment for the hair loss or a hair restoration, I would say, is 15-20%.
Okay.
I can't say कि protein खाने से बाल आ जाएंगे.
Correct.
I can't say कि PRP डालने से बाल आ जाएंगे.
Correct.
It is, everything is together.
Right.
So if the PRP is not helping out, maybe the proteins will help them out. Maybe the vitamin supplements will help them out.
Got it.
So it has to be customized.
Correct. What are the side effects of PRP? Are there any horror stories of PRP that have happened?
No. Side effect, I would say the initial discomfort. If the patients are really sensitive to the pain, some of the time they feel a lot of discomfort for 2 to 3 days.
Okay.
Because PRP is being a blind procedure.
Right.
It's a scalp. Even we give the anesthesia, we inject it. Suppose there's some nerve which is not supposed to be in that position, but it is running in that position, we may hit the nerve. And when we hit the nerve, you have the discomfort, like hitting in your elbow, you have some discomfort. That can may stay for a couple of days. Apart from that, there is no obvious side effect.
Nothing.
No.
Does PRP block DHT?
No.
No?
No.
Okay.
It is something like, it is asking कि क्या रेलवे ट्रैक पे चलने से सिग्नल लाल हो सकता है क्या रोड का? It is a totally
no relation.
Different altogether.
Okay. So basically by doing PRP, we are just enhancing the growth factors and enhancing the blood circulation and making your hair follicles get all the nutrition. बाकी उसका DHT का काम अलग है. That is a separate different.
Yes.
Now is PRP a good remedy for growing hair on the crown and on the hairline? Now जितने भी लोग ने मुझे question पूछा है, they have this one question that either they are having a receding hairline or they are losing hair from the crown. As you said, this is the temporary area. So is PRP good for the hairline or is it better for the crown, or how does that work?
Again, if you see the discussion where we started, that where PRP works where there are hair follicles.
Correct.
If the patient comes to me where he has already lost the hair in the temporal region or a crown region, then PRP is not the solution because he has lost it.
Got it.
If he comes when the thinning starts occurring, or if he is coming when he is saying no, I'm just starting to lose hair, then it is the right time to do PRP there to strengthen those areas. But if you come to the point where there are no follicles, then PRP is not the solution.
Can PRP reverse or stop the graying of hair?
No.
Nothing.
No
relation at all.
Not in my knowledge.
Right.
Plastic surgery, again, myths, lots of myths, lots of kind of false information is there. We are there as a support system to the God. We are not God.
Right.
Not a single doctor can reverse the aging process.
Got it.
Otherwise, there won't be death. No?
Exactly. And what about PRP and dandruff? Any relation over there?
No, again.
Nothing?
Again, no.
Okay.
They're two different things.
Okay.
I can say again that as I categorize it initially, the causes of hair fall, you treat that and you strengthen the hair follicle.
Right.
PRP is there to strengthen the hair follicle.
Right.
The causes can be anything.
Exactly.
It can be anything. It can be dandruff, it can be vitamins, it can be hormones, it can be your stress, anything. So treat this. Treat dandruff, give PRP.
Got it. So
give medicines.
Right. So it's like best यही होगा कि you tackle your hair loss or hair thinning or whatever that you're facing in multiple avenues.
You have to.
So I think lifestyle changes along with PRP is, I think, one of the best methods for someone who is just starting to lose hair.
That's right. I would say lifestyle changes with medicines.
Right.
Medicines.
Okay.
PRP still comes as a third
stage.
On a later stage.
Okay.
But again, bearded chokra, you have to understand that eventually it is very much important for me to assess that what is the need. What is the need?
Correct.
There are a variety of patients, and nowadays they want all customized treatment.
Right.
And it's good. They know what they want.
Exactly.
It's good.
Exactly.
If I'm pasting my treatment on everyone, there will be some patient who don't like it, who don't want it.
Right.
If a patient comes to me that I'm going to get married, I'm going to go to a conference, to the meeting, and I'm just not happy with the starting of my hair fall, do something about it. We start with the PRP medication. If the patient comes to me, no, I have to leave India in 8 months, or I have to get married in 8 months, do something about it, then it's a hair transplant. I cannot game on PRP कि आ जाएगा या 4 महीने में.
Right.
Then I have to do hair transplant, then supportive treatment, because I have a deadline of 8 months then. So it has to be customized what patient wants.
Got it. And और एक question जो सबसे ज़्यादा common था was the cost of one session or the entire treatment. I am not going to take that question because यहाँ पे आई वुड रेकमेंड कि जिनको भी इंटरेस्ट है, सच्ची में इंटरेस्ट है, सिर्फ यहाँ पे भावताल करने मत आओ. If you are really interested, if you liked how Dr. Umang has taken his time out, I really appreciate it. I can't thank you enough.
Thank you.
That you've taken out your time and you've given so much knowledge in this one video. अगर आपको serious हो आप इसके बारे में, तो यहाँ पे उनका नंबर, all the details are there in the description. कॉल करो, पूछो, यहाँ पे आओ, उनसे मिलो. People over here in this clinic are there to help you out.
Thank you.
It's just your call. अगर आप serious हो इसके बारे में, then do it. Is there anything like a final note that you want to add over here, just before ending the video?
If I would say that the digital media is there to help you out. If I want to use something, if the bearded chokra will tell me to summarize everything, I would say, yes, it's a very good media. Take positive out of it. Don't only take the negative out of it, and then use your own brain, analyze it, and then go for a treatment.
Right.
Nowadays, there's so much negativity in every aspect of your life. So you cannot catch hold of every negativity.
Right.
And these are the videos which is there as a awareness videos. These are not treatment.
Right.
Please do not take this as a blanket treatment. Good. It has to be customized. The motto of this video is to make you understand the basics of PRP.
Right.
It is not to sell you PRP or to give it to you PRP. It is just to understand what it is and take a call on that. Don't take, it's like that stunt माने बोलते हैं, don't try, अपने घर पे ये try मत करना, वैसे है. Please don't try this. Consult a doctor.
Right.
That could be any trichologist whom you trust, whom you build up the confidence with, and just consult a doctor and go forward with it.
Right.
Thank you very much.
It has been an honor. It's been a pleasure. Thank you for being on the channel. I hope you guys like this series. This is just the first video in this series. We are coming out with a lot. ये सब आपके support और आपका जो response है इस particular series पे, it all matters. And जो भी आपके questions है, अगर आपको लगता है कि I've missed out on something, leave them in the comments down below. Next time जब मैं आपसे मिलूंगा, we'll try and answer those questions. So guys, यही था आज का video, and the next video will be again with I think Dr. Umang.
Yes.
or someone from his team. And जो भी वो video होगा, I'll be posting you about it on my Instagram. Follow me over there. Follow Sir's Instagram as well. जो भी है मैं नीचे link कर रहा हूँ. Just keep a track and you will get really good content.
Ask your questions. We are here to help you out. That's it.
100%. So that's it, guys. So
Thank you.
See you.
Bye. Take care.
Bye.